How do people survive malignant bone cancer? Surviving malignant bone cancer is a complex journey influenced by various factors. The type of bone cancer, its stage at diagnosis, and the location of the tumor all play critical roles in determining outcomes. Early detection is key. When cancer is localized and found early, survival rates improve significantly. However, if the cancer has spread to other parts of the body, the prognosis becomes less favorable. There are several types of malignant bone cancers, including osteosarcoma, Ewing sarcoma, and chondrosarcoma, each with distinct survival outcomes. Osteosarcoma is most common among adolescents and young adults. When detected early, the 5-year survival rate can be around 60 to 75%. However, if the cancer has metastasized, that rate drops to 20 to 30%. Treatment often involves a combination of surgery and chemotherapy. A strong response to chemotherapy before surgery can indicate a better outcome. Ewing sarcoma is another type that responds well to chemotherapy and radiation. For localized cases, the 5-year survival rate is approximately 70%, but it falls below 30% for metastatic cases. Chondrosarcoma primarily affects adults and is less responsive to chemotherapy. Low-grade tumors treated with surgery alone can have cure rates exceeding 80%, while high-grade tumors tend to have poorer prognoses. Survival rates also vary based on the stage of the cancer. Localized bone cancers generally have the best prognosis, with 5-year survival rates often above 70 to 90%, depending on the specific type. If the cancer spreads regionally, survival rates can drop to around 70%. Distant metastases can significantly lower survival rates, sometimes to below 30%. To improve survival chances, several treatment strategies are employed. Surgical removal of the primary tumor and any metastases is crucial when feasible. For instance, removing isolated lung metastases in osteosarcoma patients can lead to long-term remission in 20 to 40% of cases. Chemotherapy is especially important for osteosarcoma and Ewing sarcoma. It is often administered before and after surgery to shrink tumors and eliminate microscopic disease. Radiation therapy is commonly used in Ewing sarcoma and other scenarios where surgery is not an option. Emerging therapies, such as immunotherapy, are being researched but are not yet standard treatments. Overall, about 68 to 75% of patients with bone cancer survive at least 5 years after diagnosis when treated appropriately. However, this varies widely based on the type of cancer and its stage at diagnosis. It is essential for patients to seek personalized medical advice from oncology specialists to determine the best treatment plan tailored to their specific diagnosis and health status. Standard treatments remains the foundation of care, while experimental therapies should only be considered within clinical trials. Early diagnosis, effective treatment strategies, and ongoing follow-up are vital to improving survival outcomes for those facing malignant bone cancer.